Hi, my name is Rachel Haley. I am doing another video yet for school. Um, this is also based off of a movie. The movie was called The Hours. Very interesting movie. This was my first time that I seen or heard about the movie. Before, with the first movie, The Soloist, I did hear about the movie and was very excited to watch it. This one took me by surprise. It was a very dark movie for emotions, and that was very clear to what they were trying to get across. The movie was about three women in three different times, and it was about Virginia Woolf. And it was actually about one of the books she wrote. And the first woman who was in the 1940s, she read it. And the other one knew about the book because of certain situations. As the movie went on, you kind of got to understand why she learned and knew about the book. But the main book that they showed in this movie, it was called Miss Dalloway. And it was a very intense book. It was about, I feel what I interpreted from that, about how she was feeling during those times of not so good times that she had during the disorder that she suffered from. And this particular movie, and with her, Virginia Woolf, I feel that she should have been diagnosed with bipolar disorder. And with that, I feel that she should have been diagnosed with bipolar 1 disorder. It's two types, bipolar 1 and bipolar 2. They're different from, more so, bipolar 1 disorder. You can have a mixed and a manic stage, as well as with your major depressive. Bipolar 2, you won't have mixed or manic. It'll be a hypomania. So, another disorder that she could have had would have been schizophrenia. She talked about how she did hear voices, and her husband talked about her hearing voices as well and feeling paranoid. These are characteristics of schizophrenia: to suffer from delusions, hallucinations, hearing voices, feeling paranoid. That is all a part of that. However, it wasn't schizophrenia because she didn't have erratic speech. When she spoke, you understood her sentences, they made sense. She didn't have a time where she had fixed false beliefs, and she didn't really have any, per se, visual hallucinations. So that did really set that apart from the bipolar disorder, because with bipolar disorder, it is characterized by episodes of mania. Also, the symptoms include euphoria, distractibility, irritability, and grandiosity, which was definitely her case. She was distracted very much. Every time she would write, it was very hard from her. And usually people with bipolar disorder, they would kind of have a little bit of a psycho retardation with their writings and movements, their motor skills. And she definitely started to have that, and that made her feel even more depressed. But But then she also had the time where she did suffer from a manic stage, and she was very, very into her writing. Usually, with a manic episode, they do hear people's voices, and sometimes they do see visions as well. Um, with a manic episode, they have really, really high energy, never tired, hardly goes to sleep, has a loss of appetite, and they're really, really focused on one particular project, something that makes them happy, something that's very enjoyable for them. And for her, it was writing. She loved to write, she loved to make stories. So this was something that she really started to concentrate in. It was also another point in time where she almost kind of got a little obsessed with death. She was starting to get into it, and it was brought to her by her niece. And she had a little bird, and it died. And the niece asked her, where did he go? And she tried to explain death to her as best as she could. But then she was trying to understand, where do they go? Where do I go? Where do our spirits rest? And what really happens? A lot of time, people with bipolar disorder, it is categorized as a depressive disorder. And sadly, suicide does accompany this disorder. Something that is not a great thing, something that we will all try to prevent. But Virginia Woolf did die of suicide. She did drown herself. And at the age of 59, she walked into a creek of water, and she put rocks in her coat to weigh her down. And she did commit suicide. It was a little bit after she was asking to go back to London. Her husband didn't want her to go to London because this is the place and the time they found out she did suffer from some type of psychotic disorder. The doctors explained that she needed to get away, get into some peace and quiet, especially since London had a lot of negative impact on her in this disorder, and it didn't make anything better. She really had a lot of manic episodes in London. That's what they have said in the movie, and that's why he wanted to move out to the country to get away from all of that and to, of course, save his wife. During her book, since she was so focused on it, she did have a remarkable sense of energy, and she did move things. She didn't talk rapidly, though. That's usually a sign of a manic episode, but she didn't sleep. And like I said, she did have a loss of appetite, because one part of the movie, she was very indecisive on what she wanted to eat. Her husband would always ask, are you hungry? You need to eat. Are you hungry? You need to eat. She never did eat. I never did see her eat in the movie, but of course she did eat. But those are signs to show that she was eating very little and really didn't have appetite, because she was so focused on this project, and that was writing this book, Mrs. Dalloway. Very interesting movie. It taught me a lot, and I'm glad I could see that. So that would be my rule out diagnosis: bipolar disorder. Schizophrenia could be a choice, and usually bipolar disorder and schizophrenia spectrum disorder are very close, and sometimes doctors and therapists have a hard time differentiating between the two. But usually through enough tests and psychological evaluations and assessments, they're able to figure out which is which. They have different treatments, and it's 4 different treatments that I'll be talking about that would be able to help a person that's suffering from bipolar disorder, and, well, really any mental health disorder. But the first one is psychopharmacological treatments, biomedical treatments, family therapy treatments, and then also um, yes. So the first one, the first one for the psychopharmacological uh, levels will be, I would say, mood stabilizers. That's usually what doctors will start off with. Usually, this is a kind of get your feet wet, get in there to see what this person can take, what they can't take. Usually, they start with lithium. It is a very effective mood stabilizer. It was actually the first mood stabilizer, and it was approved by the FDA in the 1970s. So they usually stick with that, and it's for treatments of both manic and depressive disorders. Also, anticonvulsant medications. Those are also used as mood stabilizers. They noticed later that this convulsion medication could be used for other things besides seizures. And another one is atypical antipsychotics. Those are usually tried to be used after a mood stabilizer isn't always the best. But these are also used along with another medication, so it could be used with lithium. But the ones that usually are used for bipolar disorder is olanzapine. This helps people with severe or psychotic depression, which often is accompanied by a break with reality, hallucinations, or delusions. Another one is aripiprazole, which can be taken as a pill or as a shot. Then is risperidone, zypresidone, clozapine, and also lurecidone. Those are usually the atypical antipsychotics that are used for bipolar disorder. And excuse my language, this is a little tough, but I'm getting through it. The next would be antidepressants, and these are usually treated for depression that people suffer from in bipolar disorder. They're called fluoxetine, paroxetine, or sertraline, and those are just a few that are used. These shouldn't be taken with an antidepressant though on its own. Doing so could rapidly change one's depression to a manic situation. And with that, that can be very dangerous. And to prevent this, doctors usually give this with a mood stabilizer or antipsychotic along with this antidepressant. You don't want it to be where somebody can go down and shoot up into their manic stage, which usually happens on its own, but you don't want to have a medication to allow that to happen. And it can be very, very dangerous. It's different side effects, of course, to the psychopharmacological treatments. These are loss of coordination, excessive thirst, frequent urination, blackouts, seizures, slurred speech, fast, slow, irregular, or pounding heartbeats, hallucinations, seeing things or hearing voices, of course, that do not exist, changes in vision, itching, rash, swelling of the eyes, face, lips, tongue, throat, hands, feet, ankles, or lower legs. These are all, like I said, possible side effects that could possibly come from these medications. Some others are also changes in weight, nausea, stomach pain, vomiting, anorexia, and loss of appetite. The next thing would be doing a psychological treatment, and that I think the best for that would be CBT, which stands for cognitive behavioral therapies. And with this, it's a limited structure, and it's a psychological intervention derived from the cognitive behavioral model of affective disorders. And this is where the patient works collaboratively with the therapist to identify the types and effects of thoughts, beliefs, and interpretations on current symptoms, feeling states, and or problem areas. Also, you develop skills to identify, monitor, and then counteract problematic thoughts, beliefs, and interpretations related to the target symptoms and problems, which is a very, very good thing, because at this point, this is something that they really do need, so they can have an idea of what their small goals would be, so that way they can accomplish those big goals. With knowing exactly where you want to start, you might want to start with just being able to feel better, to have a happy state, to have that certain homeostasis that you can go to keep it at a nice pace. Another thing that they would do is tackle dysfunctional assumptions, which may maintain some high goal attainment behavior. Also, learns a repertoire of copying skills appropriate to the target thoughts, beliefs, and or problem areas. And once again, that is with the cognitive behavioral therapy, CBT. For a biomedical approach, that will be dealing with the electroconvulsive therapy, so that's ECT. This is a procedure in which electric currents are passed through the brain, intentionally triggering a brief seizure. ECT seems to cause changes in brain chemistry that can quickly reverse symptoms of certain mental illnesses. It often works when other treatments are unsuccessful. So these are the treatments that are the last go to. It's a very, very evasive treatment, of course, because you're intentionally triggering a seizure. Um, with this procedure, it's almost like with the electrodes, when they stick that in there to have a brief electric moment to make the brain do something that it wouldn't normally do. So, of course, this is with having a seizure. This would change the brain's chemistry and maybe allowing for that certain part of the brain to be triggered in the right way, and they won't have these certain symptoms coming from their brain. Also, with the electrodes, with this section right here, they usually stick it up your nose and put it in there, and it would actually help with depressive disorders, especially depression on its own. Um, from the studies that I read, it has worked. It, of course, doesn't work all the time, just like medications don't work for everybody. The last one will be family therapy. And for this, I would still pick the solution focused therapy. That way, from this person, they're not focusing on their diagnosis. They already know what the problem is, so let's focus on a solution. Exactly what it says. And for Virginia Woolf, I feel that this, out of all of the models, would be best for her, because she doesn't want to hear that she has a particular problem. She wants to know that she can overcome it and get back to how she was before all of the doctors, before her husband watching her, before everybody making her feel uncomfortable and incompetent. She wants to go back to her way of living or her lifestyle before this has come upon her. For the solution focused therapy, focusing on the solution is always the best thing to do. Another one would be the recovery model, and that is intaking everybody, so their family, their community, and also healing them from the mind, body, and soul, which is a which is a holistic way and approach, which is an actual great approach. So that way everything's on one accord. CBT would be next for me, I think, especially if she didn't want her family involved in it. Because with solution focused family therapy, it is a family therapy. And you will have her husband involved, her sister, her niece, her nephews, all of that, because that's what comprised with her family, but more so with her husband. So it would almost be like a couples therapy. He was her main guardian and watched out for her to make sure that she didn't run away, she didn't harm herself or anyone else, especially when she got into those depressive modes, which she did end up leaving from her home unattended, and that is when she killed herself, sadly, by drowning. Um, CBT would be another great one because of the sense of being able to counteract with those feelings and states and those voices that she will be hearing. Um, of course, all of these approaches are good, but they all have their downfalls. Of course, with the medications, with their side effects, of course, with the biomedical treatments, it's very evasive. You don't know if it's going to work or not, and what may happen, and what actually might be worse than when you started and went in there for this treatment. Usually, with psychological therapies and with family therapies, it's not technically a side effect from it, but it just might not work for you or for that person. For Virginia Woolf, I don't think that CBT would be the best. I think the solution focused therapy would be the best for her. Also, with medications, I don't see that being good for her because of the fact that's implying that she has a disorder, something that she did not want to see, hear, know about at all, especially with her always attending doctors and seeing them. Of course, if you're on medication, you have to keep up with your doctors, you have to keep up with your medication, you have to keep going on trial and errors to make sure that everything is going right, that your body is taking in the medications correctly. And of course, also with any procedure that's evasive, anything can go wrong. So for this, I think this is a very interesting project, and excuse my little fumbles that I had through this with pronouncing different things. But I would say definitely Virginia Woolf suffered from bipolar disorder, bipolar 1 especially. And it is a sad thing, but I'm glad that there's movies out here to help to get to know a disorder and put it out there for people to learn about it, to know about it, and so they can help their loved ones. Thank you.